Okay.
Acclimated to the other room.
Thank you, everyone. This morning, the Health and Human Service Committee is meeting. We'll be speaking with Dr. Echols today, basically introducing ourselves, and committee members will ask questions about goals of working together, if you don't mind. So we'll just try to keep it on a steady pace. Mr. Clerk, we'll call the meeting to order, and could you call the roll, please?
Alderwoman Ingracia.
Present.
Alderwoman Tyus. Alderwoman Spencer. Alderwoman Green. Alderwoman Martin.
Present.
Alderwoman Navarro.
Present.
Alderwoman Middlebrooks. Alderwoman Rice.
Present.
Alderman Todd.
Present.
Chairman Ornowitz.
Present.
Alderwoman Tyus. Alderwoman Spencer. Alderwoman Green. Alderwoman Navarro. Alderwoman Middlebrook. You have 6 present. You have a quorum.
Thank you, sir. And also, Alderwoman Middlebrook and Alderwoman Green asked to be excused today, and the Alderwoman Tyus and Alderwoman Spencer are at another meeting at the same time.
Okay.
So I asked that they be excused at this time.
So noted.
Thank you. Okay, Dr. Echols, good morning. If you want to step up to the mic and introduce yourself. I know you and I have met a little while back and had a pretty good discussion. So I just want to set a meeting up for you to meet the members of the Health and Human Services Committee, and hopefully things that we can work together on, set out some goals, and whatever we can do to help, we're more than willing to do.
Absolutely. For the record, I am Dr. Frederick Echols. I'm the Director of Health for the City of St. Louis.
And Dr. Echols, did you want to just talk a little bit about what your goals are as director and hopefully some plans down the road of improvements?
Absolutely. So my typical strategy is usually to do an assessment, so assessing all of the programs, as well as this gives me an opportunity to identify areas of success, so things, the areas that the department perform very well in, and also to identify some areas of improvement. And this helps inform future decision making to ensure that resources are allocated for the right purposes, for the right programs, and even on a more granular level to the right staff. And so that's where we are now. There are some as we consider low-hanging fruit, and so one of those, some of the low-hanging fruit entails community engagement, and not just community engagement outside of City of St. Louis government, but within City of St. Louis government. So engaging other departments in a way that they haven't been engaged prior. For example, working more closely with the Department of Corrections, Department of Public Safety, Division of Public Safety, Fire and EMS to address issues related to substance abuse and opioid, to address the opioid epidemic as it relates to the City of St. Louis. In addition to that, also working more closely with the Comptroller's Office to make sure that our fiscal practices are up to par. And if there are any issues that are addressed, we have time to really make the necessary revisions through quality improvement efforts to ensure that the improvements that are made are sustainable over time. And in addition to just, again, community engagement is really important for public health. And so as we work to improve relationships across City of St. Louis government, it's also important for us to look at other components of the local public health system. Oftentimes we limit the local public health system to just being the health department, and that leads to a siloed mentality. And that's been the case for such a long time, and so we've just been busy doing public health work without properly engaging other entities across the health system that may have additional expertise, have additional insight that can help make our processes and our programs and our other initiatives more efficient and effective. And so engaging clergy There's a lot of health issues impact all the communities across St. Louis, and so one commonality amongst a lot of community members is that they go to church, and so using the church as a health platform to inform individuals about the importance not only of spiritual health but also natural and physical health. So engaging clergy in a more effective way, as well as the health system. So over the past 6 months, different situations has arose, one that has required us to engage work more closely with the health systems across the city of St. Louis to ensure that patients are properly treated, as well as to ensure the community that we serve is properly protected from communicable and infectious diseases. And again, so some of the low-hanging fruit there is potentially developing MOUs or memorandums of understanding with some of the health systems to ensure that when special situations arise that require special treatment and care for individuals, that we have a safe space to send them to ensure that, again, they are properly treated and the community is properly protected.
Thank you, Dr. Echols. And I, for one, am glad that we finally hired a director that has a background instead of just appointing people. I think that's important. So I will go down through the committee and ask some questions if you don't mind.
Okay.
So.
And I just want to piggyback on that. So I think that's part of the leadership for the city of St. Louis. So Mayor Cruson really was adamant about making sure that this position was filled with someone who understood public health. And so this is a result of her leadership and her direction for the city of St. Louis. And so I will give credit to her for actually making this a priority for the city of St. Louis.
Okay, and thank you, and I appreciate it. So we'll go down the row here. So first person is Alderwoman Gracia.
Why are you laughing when you Good morning, Dr. Echols. Thank you so much for being here this morning, and I'm really looking forward to your leadership at the Department of Health. I think it's been a place in the city that's been sorely lacking some real comprehensive, addressing of issues. And I realize you have a lot of challenges. I think one being that there's no general revenue coming out of the city budget into the health department. I guess that's more of a statement than a question. And I'm excited about the folks we have here on this committee as well. I think we're all committed to working with you to come up with some better ways. And I'm curious, have you looked at, model practices in other cities and what we can learn from them about what they're doing well or what the challenges are? And then I was also curious if you had looked at the violence that we have in this city as a public health issue.
Absolutely. So I'm always looking to see what our counterparts are doing in other parts of the country, particularly those practices that are being implemented that are considered to be evidence-informed or evidence-based. As it relates to general revenue, there is about approximately 50% of the City of St. Louis Department of Health revenue comes from general revenue. Is that sufficient? That's the question really to ask, right? And so I will say that from a staffing standpoint, there are some challenges that the City Department of Health is facing, but we're doing our best to leverage resources within the department as well as work with some of our national and local partners to bring additional expertise to our agency so that staff can operate in a more effective and efficient manner. Your second question.
Sorry, I was all over the place. I asked about framing the violence that we're experiencing in this city as a public health issue.
Right, so violence is one issue that has been on the public health forefront for quite some time. However, not until, I would say probably the last 10 years or so, have valiant efforts been made to really establish programs to address not only violence, but just the criminal justice system as a whole. However, as with any program or with any agency, you have to understand the context within their working. So one of the things that I'm having to do is also get a better understanding of the city of St. Louis, not just what we see now, but what has led us up to this point. And that goes beyond 5 decades. It goes to like a century ago. What has transpired over the last century that had led us to this position where we are today? Because a lot of times we look at what we're seeing now in the stats, whether it's STIs, lead, but the decisions that have been made over time have led us to this point. So understanding not only the decisions that have been made, but why those decisions were made. And so that gives us a better idea of how to navigate the current issues, because it's easy to develop programs and initiatives, but we don't, creating Band-Aids in this stage of, in this particular stage would be more detrimental than good. And so our goal is to really create or establish innovative ideas and programs that are sustainable, not just to patch a situation and then we cause additional issues, or patch it now and then we have to readdress the issue in a different form a decade or so later. But create programs that are sustainable over time, that are impactful across the city of St. Louis. And that requires constant evaluation of the programs, which requires a lot of effort. But using the information that is obtained during those evaluations to continually guide the programs and the program as it continues to evolve, and as the situations across the city of St. Louis evolves.
Okay. Have you met with or thought about partnering with the Parks and Recreation Department, just in terms of getting access to kids all over the city involved in the rec centers and parks?
So we have had some discussion with Parks, not particularly about access to play areas, but for some other issues related to health. And again, we're in, this is month 3 for me, and so, but that is one of the, because as I mentioned before, one of the priorities is to better engage or more effectively engage other City of St. Louis government departments.
Okay. I don't have any other questions, but definitely keep me posted if I can be helpful. I'm, again, really excited to have you on board.
Thank you so much.
Thank you, Alderwoman Gracia. Next, we'll go to, looks like Alderwoman Martin.
Hi, welcome. Nice to officially meet you.
Likewise.
I've just read a little bit about you in the news and whatnot, especially when you got when you were hired, appointed, whatever you want to call it. But one thing I really liked is that you had a commitment to working with other county health departments. I think that's great. I think especially in our region where we are really fractured, but all facing a lot of the same problems. Is there an effort, or maybe this is more of a comment at this point, but to work with outstate communities and try to move our state officials on some issues like opioids, STDs, I know, which you've addressed, just some issues where we're all facing the same, or we're, same struggles, and working to either get more money or just also address those needs throughout the state of Missouri.
Yes, I've already started having discussions with the administration, with the Missouri Department of Health and Senior Services. They understand the issues that we're facing in the city of St. Louis, and they have some of the same challenges that we have as it relates to moving legislation that supports public health initiatives. But our goal, again, is to better engage not only the Missouri Department of Health and Senior Services administration, because they've had some turnover over the last year or so, but also engaging some of our legislators as best we can to inform them about how certain initiatives or certain issues are impacting the health of St. Louis, City of St. Louis residents. And so I think that's really the most important piece. So having the data that we collect and package it in a way that they can understand it, because a lot of times when you talk epi-talk, if you will, if you're not trained in epidemiology, or if you have very little background or knowledge about epidemiology and the purpose of epidemiology, you may miss the key points. And so really using our public information officers to simplify the language to a level that everyone can understand it. And that goes not only to our legislators and other partners in the public health system, but also for general community members. When we develop press releases about health-related issues, we make sure that the language is simple enough so that the laypersons throughout the community can understand it. And that's really key, because there's a lot of resources that are available in the city of St. Louis, but if there's no awareness,
Sure.
people don't take advantage of it. And so really informing the community about the services that are available, informing the legislators about public health issues and topics, and working with our counterparts at the Missouri Department of Health and Senior Services. In addition to that, working with our counterparts on the Illinois side of the Mississippi, so the East St. Louis and St. Clair County health departments and the Illinois Department of Public Health, working with them more closely to ensure that there's proper coverage and they're aware of situations that not only impacts City of St. Louis, but may trickle over and impact their communities as well.
Great. I really appreciate it. And also, I say this at every department head, please, we love to share stuff on social media, but we never get anything in like an easy JPEG shareable form. So that's
an easy fix. We can work on that.
That would be great. I'll share everything on all social media. I just don't want to go through the hassle of like trying to save it as a JPEG and all that. So I really appreciate it. Thank you.
You're welcome.
Okay, thank you, Alderwoman Martin. Alderwoman Navarro.
Thank you, and thank you, Dr. Echols, for being here with us this morning. And I know you're relatively new in this position, so I have just a lot of general questions about the department, but I understand if you're not ready to dive into all of those yet. But please, mostly I would like to hear, just more about your priorities, things that you think are working well, things where additional resources are needed. And I started just looking at the 10 essential public health services that the health department provides, and I guess and some of these you've already talked about in terms of mobilizing community partnerships and how we're getting out and informing people. When it comes to determining, what community health problems to prioritize, how do you determine that? I mean, I know we've talked about opioids and STIs and all, there's a bunch of things out there, and I come from an environmental background, so I'm going to want to talk just a little bit about some of the environmental issues too. But for you and your department, how do you determine what those priorities are? And what do you see them as?
One key factor that we'll look at, for public health issues when we're prioritizing or making priorities across the health department is what is the impact of the particular issue on the community? How many people are impacted? What's the long-term outcomes, short-term outcomes, and is there funding available to actually address the issue? And are there staff available to address the issue? And so. Those are the key components of that we use when we're determining what to prioritize across the health department. I'm not sure if you all understand, but the health department is broken down into two components. So we have the environmental health, or the environmental services component, which is really the regulatory arm for the health department, and so they oversee a lot of the environmental issues such as lead, air quality related issues, food safety, food sanitation, as well as community sanitation and vector control and animal care and control. So that's a huge part of the health department. The other component is essentially infectious disease related, and so we have communicable disease control, which covers sexually transmitted infections, including HIV and other reportable communicable diseases for the state of Missouri. And so, in addition to that, there's one more piece that's kind of interwoven into all of the programs, and that's health promotion. And so typically, health departments will use the health promotion branch to focus on chronic diseases such as obesity, asthma, and other environmental issues that have that chronically impact the health of individuals. At this point, one of the gaps that we have is the health promotion component of the health department entails our public information officers, and then we have a contract with St. Louis University to conduct some health promotion-related outreach. But there isn't sufficient staff at this time to really have initiatives that are to create robust initiatives to address some of the issues. And so, but in order to do that, we're leveraging resources across the health system through our partnership with St. Louis University and some other agencies until we're able to bring additional staff on at the health department to fill that gap.
Can I ask you a quick question about that?
Yes.
So with SLU, so in terms of health promotion, is that what's being promoted at that? Is that promoting how to access health care? Is that promoting specific issues? Can you just talk a little bit more about what you would like to see that program doing if it were fully staffed?
So right now, the program focuses on nutritional services, and so they focus issues such as obesity, They also do some asthma work as well. And the health department as a whole focuses on engaging individuals to care, and so linking individuals to different resources through not only clinical services that we provide, but also other services that are available through some of our partners, such as the Regional Health Commission and the Integrated Health Network. And so using the health department as a referral point has become that's the state of where we are right now. But there is hope that over the upcoming years that we'll be able to kind of revamp the infrastructure of the health department so that we can better engage individuals and link them to additional services that we may not be able to offer.
Great, thank you.
The other component of the 10 essential services of public health includes research. And so that's been a component that's been lacking for the health department, in particular because we just don't have the staff to do it. So the staff are really focused on the day-to-day activities and making sure that the day-to-day function are being completed. But to address that issue as well, we have established an academic health department with through our partnership with St. Louis University's College of Public Health and Social Justice and the St. Louis County Department of Public Health. And so this will give us additional resources and additional expertise as it relates to research development and implementation to address public health issues that impact not only the city of St. Louis, but the St. Louis region as a whole. One of the things that's helping guide how we prioritize those research issues is through the data that we collect on a daily basis and some of the reports that we're starting to generate through with our epidemiologists. One recent report that was published was a mental health report for the region, and so it gives an overview of the state of mental health for the St. Louis region, but also breaks down the mental health issues that are impacting the city of St. Louis and St. Louis County. And so that's something that I can forward to you all if you all are interested into that in that information.
Yeah, absolutely, please do. And will the reports that are generated by that group be available online, or what's the best way to access those? And I realized if they're medical research academic papers, some sort of abstract would be really helpful for someone like me.
All right, so this is actually a public health document, so we made sure that the language is, again, simple enough so you can understand the terminology and what we're trying to convey in the descriptive language that's included. And so I can send that document to Alderman Arnowitz, and you can forward it to the members.
Yes. Okay. Yes.
Okay.
Yep, that would be great. I think, mental health services are so important because, if people aren't accessing those, I mean, there's so many other things, I mean, as you know, that follow from that. A lot of the issues that we're dealing with on day-to-day could probably be really mediated if people were getting access to services proactively before that. One of the other things on here is making sure to ensuring that we have competent public health and personal health care workforce. Can you speak to a little bit about how your department is helping support that workforce?
So workforce development is important for the advancement of any organization. And so one of the things that we're doing is making sure that we utilize the resources that are available through our academic partners, whether St. Louis University as well as Washington University. And we've recently utilized resources that are available through the Southern Illinois University of Edwardsville to do a workforce development assessment for our department. And again, that's really critical. And as public health evolves, as the situations and the environment across the city of St. Louis evolves, we need to make sure our staff are properly prepared with knowledge to address some of the issues. And so having ongoing training for staff is really important. And so some of the resources are available locally. There are other resources that may not be readily available locally, but through connections at the national level, we're able to utilize, bring some of those resources to the city of St. Louis to ensure that not only our health department is properly trained, but we also offer those training opportunities to our neighboring jurisdictions, such as St. Louis County Department of Public Health.
Great, thank you. I'll just finish up with some of the kind of environmental issues, which is where my background is, and so very concerned about air quality, for example, and asthma, which you've mentioned. And I'm curious, are you familiar with the Westlake Landfill in Bridgeton?
Yes.
This is something that I know the St. Louis County Health Department's been very engaged in, and even though, for anybody who doesn't know, this is a radioactive site in Bridgeton. It's about 8 miles upstream from our water intake. There's an underground fire. It's in a seismic zone. It's in a floodplain near hospitals, near schools. And while it's located in St. Louis County, if anything were to disturb that site, which again, in a seismic zone, tornadoes, flooding, all of those things, it would have an impact on the residents of the city of St. Louis. So I am curious where that is on your radar, or what conversations are happening so that we are prepared. There is a plan to start removing that waste, but it's an extremely dangerous situation for the workers there. And again, if it gets exposed to groundwater or to the air, that's going to be it's going to be a crisis situation for everyone in the region. So if you can just talk to me a little bit about, and I know you've only been in this position for a few months, but you know, anything that you can say about what the health department is thinking around that issue would be really helpful.
All right, so in my role at St. Louis County as the Director of Communicable Disease Control Services, this was an issue that came up, and I'm pretty sure you're aware of a lot of the efforts that were made by the health department at that time to address some of the issues surrounding the Westlake landfill, or the Bridgeton landfill. And so what our focus is now is making sure that our emergency preparedness teams are properly engaged. And so the landfill is only one potential public health emergency that may happen to impact lives over the next few years or so. But there are other issues that are more common. And so tornadoes, as we've seen, flooding, as we are currently experiencing across the state, are also public health emergencies. And so we want to make sure that one of our goals is making sure that our emergency preparedness programs, as well as the emergency management agencies, are constantly in touch with one another, and that they have good working relationships. So when something large does happen that impacts a significant percentage of the lives in our jurisdiction, that we have the proper infrastructure in place. And so we typically use the incident command infrastructure to make sure that information is properly relayed to individuals, as well as to make sure that there's timely communication and timely updates regarding the status of the situation. And so that's something that we've practiced regularly. When I was in St. Louis County, one of the things that we started doing is standing up our emergency operations center more regularly. So, for example, if there was a barbecue in Wildwood, and we stood up our Emergency Operations Center just to practice, because you only play as well as you practice. And so if we aren't practicing on a regular basis, then there are missed opportunities, and then what ends up happening is you aren't fully aware of the resources that are available or some of the issues that may arise. And so that's also the goal with the City of St. Louis Department of Health, really practicing more regularly to make sure we are prepared as best prepared as possible in the event that a natural or man-made disaster were to occur in our region.
Thank you. And regarding flooding, which is obviously on all of our minds right now, I don't know that people always fully, I'm sorry?
No, I'm agreeing with you. I know.
Recognize the public health issue there. I mean, one, there's the immediate, obviously if water is inundating your home, but then there's the mold issues afterwards. There's also the fact that water is contaminated with, all sorts of things, especially if it's come off of any sort of agricultural land, if it's been washing through a Superfund site or whatever it's coming through. And can you talk a little bit about the public awareness campaigns that are undergoing, if there are any, in terms of just educating people about not getting close to the water, not touching the water, and then any efforts to address mold issues and any other related health issues that come after the floodwaters have receded?
Absolutely. So yesterday during the mayor's briefing, there was some discussion around the preparations that are being made across the city of St. Louis to address, at least prepare for flooding in the area. And one of the components of that telebriefing was just some public health messaging around avoiding floodwaters, and also kind of outlining some of the complications that could arise, or some of the consequences that may occur if individuals are to engage or with floodwaters. And so that's the initial response. And then what we also do is after the flooding has subsided, we also put out additional messaging to inform individuals about simple steps that they can take to prevent mold, or if there are resources needed to remove mold. That's something that we typically link individuals in the community to. So we'll provide information about resources that are available, as well as simple measures they can take to protect themselves and their families from not only environmental issues, but also communicable disease issues that often arise after flooding occurs.
Great, thank you. In regards to lead poisoning, which you referenced earlier, what would you say the current status is of our efforts to address lead poisoning in the city of St. Louis?
So home remediation is a huge component of that. The health department's current role is, we do screening for children. Mm-hmm. And we make sure the screenings are readily available. One of the things that we're aiming to do is to market that service a little bit better so parents can that are uninsured or underinsured know where they can bring their child to obtain lead screening. And working more closely with other City of St. Louis government offices or departments is going to be really critical. So working with the streets departments as well as the building departments to address some of these issues is also critical. And so I haven't personally had those conversations with those other departments as of yet, but that is on our to-do list.
Do you know if there's a report with numbers in terms of how we're doing and in terms of reducing the number of kids exposed?
Yes, so we do have data for the City of St. Louis. The most current data that's available through the state goes back to 2017, so it doesn't reflect it's not the most current information, but we can share that with you as well.
Okay, great, thank you. I don't think I have anything else, but if there's anything else that this is your chance, I would say, to brag about anything that you're excited that's happening, or anything that you think, your department's doing really well, things that you're kicking off that you want to make sure that we know about. Part of our job is to make sure that people understand the good work that's being done at the city.
Absolutely.
So, go for it, if there's anything else.
One of the opportunities that I've had during my short tenure as the Director of Health for the City of St. Louis is meeting with each individual staff to understand their understanding of their role in the health department, as well as how the health department functions. And what I can tell you is that we have an extremely diverse staff with a great wealth of knowledge as it relates to implementing public health. And that's really exciting for me, because as we move forward and we address some of the issues, I know that we have a good team in place to actually to lead the charge. Some of the great efforts that are being made, one is through the Department of Justice, and this effort entails doing an assessment or an evaluation of the criminal justice system in the city of St. Louis. And so this is a huge undertaking, but this project will hopefully start in July and go over the course of a year. And what this will lead to is a better functioning Criminal Justice Coordination Council. Are you all familiar with the Criminal Justice Coordination Council?
I'm not.
Tell us more.
Wonderful. So the Criminal Justice Coordination Council is it's a multidisciplinary group that includes individuals from city courts, law enforcement, public health, some community-based organizations and service providers, as well as City of St. Louis Police Department, Fire and EMS, and they're coming together to serve as a soundboard for criminal justice-related issues that are impacting not only the City of St. Louis government system, but also the individual lives that are funneled through the system. And so the goal is to utilize the data that's obtained during the evaluation to guide how this group functions, and also it will help inform the priorities that are established by this particular group. And so there's an opportunity for all the persons to sit on the board, and we actually welcome you all to serve on one of the committees. There's a public health work group, and we would love to have your input. I think you all have a good fund of knowledge about how the City of St. Louis operates. In particular, you can speak to issues that are impacting your ward in particular. And so we would love to have your input. So, and again, so the goal of this group is to be a soundboard for criminal justice related issues, and with the intent of improving the criminal justice system and making any needed tweaks to improve how the system works and how the system functions to protect individuals rather than punish them.
I've never been told that before. Could you let us know when the meetings are? Like, what's the best way for us to find out how to be involved if we would like to be involved?
Absolutely. I'll forward the information to Alderperson Arnowitz. And
That sounds good.
Great. Thank you. I have no more questions. Thank you so much for
we have
for
some
being
other
here.
great initiatives that we're embarking upon as well. So there's as you all may be aware, there's a hepatitis A outbreak that's occurring in certain parts of Missouri. Luckily, we haven't had an outbreak in the city of St. Louis, but we have resources that have been made available to us by the Missouri Department of Health and Senior Services. And so what we'll be doing is working with the Criminal Justice Department, so Department of Corrections, Commissioner Dale Glass, and his staff, as well as the agencies across the city of St. Louis that offer temporary housing for individuals to make sure that they have access to hepatitis A vaccine. Again, the goal for that is to ensure that those populations are properly immunized. If you look at what's happening across the nation, the populations that are mostly impacted right now by the hepatitis A outbreak are individuals that are incarcerated and individuals that are homeless.
Thank you, Dr. Echols. Thank you, Alderwoman Navarro. Alderwoman Rice?
Thank you. You've given us so much information, and I have just cascading questions coming off of this too. So I apologize, I'm not trying to bombard here. Specifically on, so I was not aware that we had a hepatitis A outbreak in Missouri. So thank you for that information. And it's good to know that your office is working on this. I do know that we have significant STI, STD rates in the city of St. Louis, as well as in outstate areas. And one concern that I have, and I realize that this is a bit of a political thing at the moment, is if we have one of our main health clinics that serves reproductive health that is potentially going dark tomorrow. Has the health department, have you evaluated how we're going to be working on testing and treatments if the Planned Parenthood facility closes?
So one thing that you all probably aren't aware of as well is the City of St. Louis Department of Health has a STI testing and treatment project. So to give you some background, so years ago there were only two sites in the City of St. Louis that offered free comprehensive sexual health screenings and treatment for uninsured or underinsured individuals, which led to essentially significant health access issues. And so last year, the City Department of Health, we worked to revamp the structure of that particular project. And so what we did was we published RFPs, there was significant interest from across the St. Louis region, and the end result was establishing 11 access points across the city and the county that are available to provide comprehensive screenings and testing, comprehensive screening and treatment for individuals as relates to sexual health services. And so Planned Parenthood is one of our partners. They've done a lot of amazing work for us, but they're one component of the system. And so we are thinking about how to fill that gap if that particular site is to close. And one thing that we also aim to do is to better market the services that are provided in the locations that provide them. If you all aren't aware, the City of St. Louis opened its Health Stop, which is a location that offers sexual health screenings at no cost to individuals that desire it. This is located at 1520 Market Street. The hours are also readily available, and so individuals that used to seek services at Planned Parenthood, they can use that as an option. We also partner with the St. Louis County Department of Public Health. They have a sexual health clinic at on Jennings Station Road at the Pine Lawn location, and they're one of our partners, and so individuals can also be referred to that site if they desire comprehensive sexual health screenings as well. And so there's a network of providers that are coming together to really help fill the gap.
Okay, thank you. So one of my other questions, I guess it's great to know about the Coordination Council, and I echo Alderwoman Ingrassia. I would love to know more about that and about how we can help out there. Thrilled that the health department is a piece of that, right? Because public safety and public health go hand in hand, and if I had my way on this, we would be flipping our funding and be throwing a whole lot more funding at your department to oversee programs, to have actual fact and data-based interventions and processes to address the entirety of the city. And so on that note, I have a question about your budget. In the previous years, we've been told that the health department budget continues to get cut. There are positions that have been eliminated. Funding just isn't coming in the same way. And so I just want to clarify, you said that 50% of the budget does come from general revenue for the city?
Yes.
Okay. So where does the other 50% come from?
Federal funding.
Federal funding, okay. And do you have any specific, are there any special taxes or things like that that come directly into the health department, or it's all just grant money, federal money?
All just grant money, federal money.
Okay. Comparatively to other cities our size, I mean, you worked in the county, you've worked for the state of Illinois, and what are we looking at as far as our funding? Are we significantly underfunding your department in comparison to other cities our size?
Also, there are some fiscal challenges.
Okay.
And there's definitely, I guess, there's always desire for more, but we also want to be mindful that we're properly utilizing resources that we currently have. Some of the special items that are present in other jurisdictions, such as special health taxes and so forth, we don't have that in the city of St. Louis, but we do have significant support from senior leadership across city government. And so although the funding is limited, what we have to be mindful of is, that there's a system that's ready available for us if we desire to engage it. And so with the health systems being in place, Washington University, SSM, they're amazing health systems, and so really engaging them in a way so we can leverage resources to address some of the public health issues that the city is facing, as well as, again, as I mentioned before, working more closely with the other departments in city government. It's really important for us to fine-tune and improve those relationships prior to just dumping additional funds into the health department, because one thing we don't want to do is waste taxpayer dollars just filling positions. That can be easily done, but that's not the approach that we desire to take at this time. We really want to make sure that we have staff that are properly trained, that the environment is supportive for all staff that are working with the health department, and that the staff feel like they have a voice. So when there's innovative ideas that are coming from frontline staff, those ideas are heard across the department and even by myself, and so that can lead to an improved working environment, improved culture across the health department, as well as improving our ability to innovate or implement innovative initiatives, because you have buy-in from the front line, you have buy-in from the implementers. Mm-hmm. A lot of times that's the most difficult task, is getting their buy-in, by allowing them a space to share their ideas and support them in this sharing is really important. And so that's one of the things that we're trying, that has become a priority for me over the last 3 months.
That's great. One of the things that I think a lot of us hear around City Hall is that, well, this is the way that things have always been done. And so I am very glad to hear that you're thinking outside the box, that you're asking your staff to think outside the box and think about what they've been wanting to do all of these years and may not have been able to do. So that's great. So apart from the budget, which is very artfully answered, thank you for that. But what about oversight of our health department, comparatively for other cities our size? does our health department coordinate services in the same type of way? Do we have oversight of the same types of programs as other cities? Do we function in sort of the same way as other health departments do?
So yes and no. So some health departments have provide direct clinical services.
Okay.
Others contract those services out, or they utilize the health systems or community-based clinics that are available in their jurisdiction. And so we have a mix. And so we provide direct clinical services for the provision of tuberculosis care.
Okay.
For individuals that are diagnosed with tuberculosis. We also provide, again, as I mentioned before, lead screening, and sexual health screenings for individuals that are uninsured and underinsured.
Okay. And I will say, one of the concerns that I had heard from constituents in talking about a merger proposal was one parent specifically said, the St. Louis City lead inspection process is exceptional, and that they had run into issues in the county that people hadn't been able to get those inspections when they needed to, and so they said, can you please make sure that what we have in the city works and continues to work for the whole if we're doing this. So it's always great to get good feedback too. That's positive feedback there. One of the things that I know is in our budget for 2020 is increased funding for demolitions of buildings. We have significant vacant buildings and falling down buildings. But what I'm concerned about is the effect on the people who live around those demolitions, right? Is there increased funding coming to your department to make sure that these are wet demolitions, that they're clean sites, that we aren't just putting lead and asbestos and other things into the air? Because from what I know, the health department has been doing more towards this, but if we're flooding that particular piece, demolition of buildings, but not also giving your department the support that they need to monitor those things, then we have a public health problem.
Right, so that's a great question. So the health department has had recent meetings with the Missouri Department of Natural Resources. So we have an agreement, or we're working on an agreement with them to ensure that there's proper monitoring for these demolitions. We also have a good working relationship with the buildings division. And so although the bulk of the work, pretty much all of the work is done by the building division, they're doing an amazing job making sure that the proper precautions are being taken to protect the community from asbestos and lead and other issues that can potentially impact the health during demolition, health of others during demolitions.
Okay, and so if residents are seeing things, and so this could be on private operations as well, if someone is seeing a demolition take place and there's dust coming up, there's dust on neighbors' porches, things like that, who is the right person for them to call? Do we call the building division? Do we call the health department, DNR? Who's our main contact there?
They can contact the Environmental Services Division at the Health Department.
Okay.
They can also submit complaints through CSB.
Okay.
And I'm not as familiar with the infrastructure in place for the building division to accept complaints, but those are two options that are available to community members that have some issues or questions around some work that's been done in their neighborhoods.
Great. And then, so on the asthma front, I know Alderwoman Navarro touched on that a little bit. We know from the Equity Indicators Index that is absolutely our lowest score. It's racial disparity in asthma rates. And is this something, well, first of all, has your office and your top staff review the Equity Indicators report specifically, around the health indicators there, and is that something that you're incorporating into in your department as we're going forward?
Absolutely. So we often reference the report that's published by the Robert Wood Johnson Foundation, which is the Health County Rankings. And for the state of Missouri, for health outcomes, so there are 115 counties that are listed for the state of Missouri. And of the 115 counties for health outcomes, City of St. Louis ranks 112. So there's a lot of work to be done. And the one thing that we try not to do, that we're trying to get away from, is siloing different issues, because what we're learning is everything is interconnected, right? Absolutely. And so we have poverty is an issue, STIs are an issue, asthma is an issue, lead is an issue, but when you look at the communities that are that shares the greatest burden of these issues, it's the same across the board. And even on the county side, when we looked at the county the components of the county that share the greatest burden of those issues, it looked the same. We can map it out, we can give you data reports, and it looks the same. And so doing a better job of really engaging trusted members from those communities is going to be key for us to, one, gaining trust from the community, and then making sure that we continually engage the community around these issues, because for the health department to come in, let's say once a year or once every 2 years, that's not sufficient.
Sure.
It's not sufficient. And so leveraging the resources across the board of aldermen through some of the other community-based organizations is going to be really essential for us, but also increasing our footprint as it relates to having a presence in the community, to be a common face in the community is really important, because we have to gain the trust of the community to move the initiatives forward, because we need to empower. If we're not empowering the community to make healthy decisions in our absence, we're handicapping them. And so when we leverage resources to create public health messaging, preventive messaging, the goal is to empower individuals. So not only can they take care of themselves, but they can become health champions in their own community and help address these issues when beyond business hours, if you will.
Yeah, great. That's great. And one of the things that I was going to ask about, there are, I think it was in Minneapolis, their health department just declared racism as a public health issue, right? And it was like, well, yes, of course that is. And I will say, I sat through the racial equity training that was put on by the mayor's office last year with a number of members of the health department, and was really glad to see them in there and see numerous members of departments across our city engaging racial equity and understanding what that means, and especially coming from the public health perspective. And because it's a common thread throughout all of this, is that there are disparities here. And so I very much appreciate that we're admitting that we're working towards equitable outcomes here. And I just, like I said, if I had my way, we would be flipping our budget and flooding your office with resources, because there are so many pieces where health of our citizens should be that should be the primary focus for us, and it impacts every piece, and it's a web, and I am thrilled to hear you speaking in that language, and to be able to communicate that to us, both in the Ways and Means hearing was great, and here as well, and I hope that we can have your office and you in front of as many people as possible, so that we can have a common vision on this going forward. So thank you so much for presenting today.
Thank you. Now, just to piggyback on what you said, so as a public health issue, so we did identify racism, but in a larger context, we have to consider a process called othering. Right. So when individuals may not conform to what we consider to be normalcy, we treat them in a different light. So whether that's transgender individuals, whether it's minorities, whether it's individuals with different ethnic backgrounds, and that's not what we're here to do. As a public health agency, we're charged to provide health services and health information to empower all individuals within our jurisdiction. And so that's what we have to move towards. I think understanding the historical context of not only the city of St. Louis, but the state of Missouri is critical if we're really serious about moving the needle of racial and health equity. Without understanding the historical context, we're shooting our darts blind. Because several communities across the state, even within the city of St. Louis, have been impacted by racially motivated or othering motivated decisions that have been made, and what we ended up doing is disenfranchising populations, ostracizing populations who at this point may feel like they no longer have a voice. So how do we gain the trust to bring them back to the table? And how do we ensure that once we bring them to the table, they feel safe enough to share their story? Because their story is really what we need to move our health initiatives. That's what we need to move other initiatives across city of St. Louis government.
Great, thank you. That's no further questions.
Oh, thank you, Alderwoman. Move on to Alderman Todd.
There's a program, Doctor, called Cure Violence, which is a medical model, and it has a proven track record of results, best practices of reducing violence. What is your position on it? Have you heard of the program?
So Cure Violence is a program that has been nationally recognized. If you're familiar with it, it has 5 components. There's an implementation component, and there are 2 implementation components, if I'm not mistaken, and 3 core components. But lack of either of those components means that it doesn't fit the core Cure Violence model. So prior to determining whether or not a program is appropriate for the city of St. Louis, we have to kind of do what I just finished talking about, understand the historical context, because every project or every program that's implemented, whether it's evidence-informed or not, may not be appropriate for the city of St. Louis. One, we're going to have the infrastructure in place, or we may need to establish some collaborations within the systems to ensure that once something like Cure Violence, if it's implemented, that it's sustainable over time. So if you adopt a program without the proper infrastructure, you're setting yourself up to fail. We're not about failing in St. Louis. And so the evaluation component for any program is really the most critical. Not only evaluating the program, but also evaluating the current infrastructure of the city of St. Louis government. And so having this independent organization come in and evaluate the criminal justice system is really important across the board. It's important for the health department, it's important for Division of Public Safety, Fire and EMS. It's important for everyone that they understand the outcomes of this evaluation. And that gives us the information we need to move forward. Just moving forward without proper data, we end up failing, and we end up wasting resources, and we end up wasting time. And we can't afford to do that. And so I know Judge Jimmy Edwards, he's well aware of that particular program as well as Chief Hayden. They're both well informed about that particular program. But we have to do our due diligence on the front end to prevent doing, not only wasting time and resources, but also we don't want to harm individuals within our system as well.
Okay, thank you. Also, when we talk about health, studies have shown that even vacant lots, tall grass, vacant buildings are mental health issues. There's many theories and theses that have been done and studies, and example is one was done in Philadelphia. What is your position on health? How do you think the environment itself, especially the environment created by the city because of lack of service over a long period of time, what impact do you think that it has on health?
So vacant properties can have can lead to poor outcomes in particular areas. One, particularly if there's infestation of pests in the vacant lots and so forth, that can lead to health outcomes because some pests do carry disease, and so if there's if the pests migrate to other parts of the neighborhood where individuals are living, that can lead to issues that, again, adversely impact the health of individuals that are within other households. And so what we aim to do as a health department is, one, we empower our community sanitation staff to go out and do their assessments, also to enforce the code that's been created for the code that's been established for the city of St. Louis. And again, the ultimate goal is to protect the health of citizens. And so if issues are identified, the Environmental Health Division, which is I mentioned before, the regulatory arm of the health department, can take the necessary measures to either handle the situation or relay individuals to other departments within the city of St. Louis so that the issue can hopefully be resolved.
Okay, thank you. I don't have any other questions.
Thank you, Alderman. I will ask, does anyone have any follow-up questions or? If not, Dr. Echols, thank you very much for attending this morning and meeting with the members of the Health Committee. We very much appreciate it and look forward to working with you. So there's not any more questions, I'll entertain a motion to adjourn.
Make a motion, we adjourn.
Motion made.
Do we need to make a motion to adjourn? Okay, second then.
I'll third it then.
Motion made and seconded, that our meeting is concluded. Thank you.
Thank you all.